So often doing pathology effectively is about having a structure. And this first one is how to talk about when you look at a globe, okay? So there's a variety of phrases that you can just go through and memorize. So if you're looking for language to say, just look at these lists, okay? How to report an enucleation. That's what that list of pre-work is for. And back to, have I just closed it?
Tab's gone away. I think so.
Oh, God, this is really. Fortunately, I have Google Classroom in my shortcuts. There we go. So I'm modeling here why you need Google Classroom in your shortcuts.
Yep. I put mine in my bookmarks. See at the top there, Diane's got things. I've got my,
Yeah.
I made a folder and I put all my Ransco I stuff in there.
All right, so back to my chat. All right, so we're going through the classwork. If you are just watching the video here. All right, so yes, textbook pre-work, our genomics lectures here that you can watch, 3 hours worth, how to examine a slide, useful phrases, what CuraCloud pre-work you definitely need to do before you come along. And then there's how to answer written exam questions, most of which I will cover in the talk that I did today. Then there's this useful one, approach to the histopathology of the globe. So again, often it's about finding the right language. Okay, so for example, if you were looking at the ciliary body, okay, so the ciliary body, for example, pathologic disturbances, we might talk about the pigmentary disturbances, the exudates, scars, for example. So it's about what to look for positively in each part of the globe when you're like examining it, trying to find out what the pathology is. It will be useful to become familiar with this, but not memorize it, because this is how we will teach you to apply it when you come and join us in a month. Okay. We have a list here also of key resources. One key resource is the ophthalmic pathology curriculum. When people say, what do I need to know for the exam? This is it. There are online slides that we recommend that you practice with. So it's often good to read a section in a textbook and then go to an online slide and see if you can find the abnormalities. I particularly like the AAO Pathology Atlas. You have to do a bit of joining, but it is free.
And we've used slides from these resources and we've incorporated them into the CuraCloud lessons. So the CuraCloud lessons are probably the beginner step, because just jumping into a pathology atlas, it can be rather overwhelming. Because
it is. So yeah,
yes,
go to
CuraCloud
the
is guided. You've got guide rails.
Okay.
First.
So you have to create an account or log in, but it does have good slides.
And you will need that because we have used these slides, and you need an account in order to access these slides for teaching purposes.
Okay. There's this open document here that I suggest you add to, which is old questions and model answers. Okay, so these have been compiled by previous registrars. There's a very limited range of questions that get asked, particularly in the general pathology section. They're just repeated and repeated and repeated. So if you generate model answers, then you will probably be able just to roll them out when you come to the exam. Okay. But this is but you can paste things into this when you find extra questions. Okay, Amanda, I'm just going to stop sharing for a moment.
So I was just going to say, if you're going to use this resource to test yourself, then of course you just cover up the answers first, test yourself, and then you can identify the gaps in your knowledge when you have a look at the model answer. If you just read through the question, then read through the answer, actually you're not learning anything, you're just reading.
Okay, so now Amanda, it's time for you to talk about your favorite reference resources.
So my favorite reference resources are Eagle Eye Pathology, should be available everywhere or from the library. I actually have a physical copy as well as a digital copy. I use them both. Now, when searching, the digital copy is good, but when I've got a digital slide up on the screen there and I need to look something up, I find this is good because it gives me more screen real estate. If you're going to use a digital copy of the textbook, then I suggest using it on a different screen or on your iPad, for example, because your screen is now going to be your microscope. So you need picture space for the slide as well as space to look at the resource. So everybody needs that. I also use the AAO, which is available digitally. I have both copies as a digital and as an e-resource. Those are my main ones. Forrester for the specific chapters on genetics and microbiology.
So you can use old editions. You
Yeah.
can just get them passed down to you. My pathology has not changed that much, except for the genetics, really. It's really valuable having a physical copy, even if it's old. So get your mates who've just qualified and are earning $1 million now, and to give you their old textbooks.
Yeah, physical textbook's good, and yeah, two versions is even better.
Okay. So far, we've made sure that you can access the resources, except for Melvin and Liam, who I will sort out. We've told you that you need to look at the prep sheet to learn stuff for the first day. We've made sure that you understand what CuraCloud is useful for, and that's giving you practice at slides in a guided way. We've put the idea in your head that you need to help each other by finding out old questions and posting them on that document. And before we set you free to follow the guidelines of the curriculum and actually try and put things in your head, Amanda and I are going to talk to you about the most effective way of putting things in your head, which is where I share screen again and Amanda and I.
Oh, okay. We're going to do the Amanda and Diane show.
The Amanda and Diane show. This is it. The Amanda and Diane show. Okay. So
who are we going to have? Who's our protagonist today?
Oh, I haven't. I've kind of. We'll see.
Okay, it'll be a surprise for me.
Right.
Yeah, I'm waiting.
Here we go. I'm going to do it on PowerPoint. All right.
Oh, there we are.
Okay, so this is meant to be me down here. I had purple hair for a while, but I've gone back to brown at the moment. Okay, so how should you learn? How should you learn most effectively for your registrar exams? Okay, so Amanda, I think this is
this is my one. Oh,
you'll have your part.
Okay, so the first part of effective learning, everybody knows this, is the input. It's like a computer, isn't it? So we have reading, watching and listening, which is exactly what you're doing now. And of course, then we'll be looking down the microscope or actually looking at visual. We're going to learn visual learning to interpret a slide on the screen. So that's the input part. Next slide, that's called encoding. This is just a little bit of neurocognitive behavioral science. So here is Trish, our protagonist, and she, in our story, Trish is having problems with her exams and she's failed her part 1. It's because she does a lot of encoding. She reads a lot, she watches and listens a lot, and she's looked at lots of slides. It's gone into her brain. But the problem is retention. She doesn't have the retention. She can't bring the information to mind when needed in exams, or even more importantly, in a clinical situation. So you see the learn something dot there. See that forgetting curve, which drops off exponentially over time. It happens to all of us, and this is a normal thing. Who has not experienced the forgetting curve? You know, In that case, you're probably not one of us, like an alien. Okay, so the meta-analysis shows the effect size on learning just back there was really small, just the input part. So how do we ameliorate the forgetting curve? By retrieval practice. So after Trish learns something on day one, a week afterwards, she goes back and tests herself and relearns her gaps. And then a month after that, she tests herself again, identifies her gaps, and relearns the gaps. So you can see how the forgetting curve shallows out over time. And 6 months later, for example, or 3 months later, is going to be your exam, which is the crux point for your retrieval practice. Next slide.
So one of the reasons that we do this intro and then space out the recall is we're about here, right? Okay.
Yeah.
So we are trying to, when we meet with you, we will be getting you to retrieve stuff so that it stays in place for the exam, which means you have to input it first.
Which means you'll learn something is all that pre-work, the Kura Cloud and the Google Classrooms and the pre-work, so that we're not teaching you for the first time. We are helping you retrieve, and that's much more powerful.
Yep.
What's next?
The learning pyramid. Okay. Yes. So the reason we don't give lectures is because they're really ineffective way to learn. And even if you watch our wonderful videos and demonstrations online, you won't learn very well. But we recommend that you do discussion groups, practice by learning, and teach others. So I know that you kind of know each other, and it would be really great if you got together and formed little Zoom groups where you actually had a learning program and discussed it, or even better, taught each other in the lead up to it. Now, some people are naturally in the same place, but it is really powerful, yeah, if you can practice by doing. And we're going to show you some ways to practice by doing as well. Okay, so we've encoded it, but now we have to know how to retrieve it. And here are some tricks on how to retrieve it. I'll just do the next slide. This is Trish again.
Trish.
Still, yeah.
She's making an intermediate form of memory. It's outside of her head, but it's outside of the reading, listening, and looking. So she's made notes, flashcards, slide sets.
Okay. And, sorry. Do you want the back one? Yep.
Yep.
So how can we do this effectively? All right, off you go.
Oh, note taking. So we all take notes? Yes. Who's heard of SQ3R? So yeah, no. So note taking, there are effective ways and ineffective ways. I'll talk about SQ3R and Diane will talk about Cornell Notes. You can just Google this up. So that's an acronym. Survey, you look at all the material first. So I'm going to learn the chapter about uveal melanoma. So I open the chapter on uveal melanoma. I look at all the headings first. Then I look at all the pictures without reading the small print. Then I write myself questions. What are the prognostic factors? What are the genetics and genomics? And what are the something? That way I'm priming my brain so that when I actually do the reading, I'll be able to extract that information quickly and easy because I have set myself some questions. So survey, query, then I do the reading. So I read all the small print. And then I'm recalling to answer my own questions. What were the prognostic factors? What were the genetics and genomics? And then, of course, I'm going to review what I learned 1 week, 1 month, 3 months later. That's SQ3R when you've got a block of text to read, for example, textbook.
And the good thing about SQ3R, when you write all those questions down, they're usually the kind of exam questions that you're going to be asked, and you can send them to your cohort and see if they can use them to test themselves to recall as well, which is why working together is really important. I'm going to tell you now about the Cornell note-taking system, which I quite like. All right. So in the Cornell note-taking system, you have done the SQ3R, you've written your questions, okay, and then you actually make notes about what's in there. So you divide a paper up like this, right? You draw a big eye on it. The top here is the heading, right? And then here you write your questions in this bit, and then you write the notes to answer them. And then down here, you write like a very quick summary. So why is this a good way to do it? Well, the first thing is you can cover up bits of the paper. So let's say that you were just wanting to do a quick recall revision. You would cover up this bit here, answer the questions, and see if you can still recall it. Okay. Or if you're wanting to do a very quick revision because you're on to review number 3, you would say, okay, what are the 3 most important facts about uveal melanoma, genetics, and there they would be there. Okay. So
it
here, for example,
the testing of yourself.
So here it might be uveal melanoma genetics, and here it might be what is the importance of chromosome 3? What is the importance of chromosome 6, 8? What do we use BAP for? Is the Ki67 index important? And you'd have notes answering those questions here. And at the bottom, you'd have 3 facts. And the 3 facts might be, we no longer do FISH. We just do BAP. PRAME is important in determining prognosis. Okay,
So what about just rereading? Rereading is really popular, and so is highlighting, Diane. So how come we didn't put those here?
Because they're right at the right in that ineffective bit of the pyramid. Yeah, you've got to actively recall.
Yeah, so just highlighting. No, it gives you an illusion of competence. You think you know it, but you don't.
If you don't like Cornell Notes, you can use Anki. So Anki comes with a built-in algorithm where you can say whether you know it or not, and then it doesn't bring up the notes again. So people have used Anki really, really effectively. Again, this is a collaborative event because you can make Anki cards as a group. Okay.
Yeah.
Next, there's the learning theory pyramid again.
All right. Oh, you've changed the Feynman too. Explain it to me like I'm a patient. Yes, that's good.
Okay, so another way to actively learn it and is to rephrase it in your minds to try and teach others. And a really good way to rephrase it is to take it down from technical understanding to layperson understanding. This is also quite useful professionally. So ELIP, explain it to me like I'm a patient, right? So if you want to challenge somebody in your learning group or even just challenge yourself, you could say, okay, explain the genetics of uveal melanoma to a patient, okay? And only when you can do that can you really know it, and it's bringing it back up again. So all these are tips and tricks to help you with your revision. You have to first encode it in a useful way, like in the Cornell notes. So say, I'm going to encode it, SQ3R it, record it in the Cornell notes or Anki cards, and then bring it up regularly and explain it like explaining it to a patient. Okay. So I want to emphasize again the priming effect and how useful it is to write questions for yourself, because these questions will form the basis of answers that you are about to write in your exam. Okay, so let's think about exam questions for a minute. Often exam questions kind of go blah, 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 and then ask a directed question, don't they? And you can rephrase them. So, so here we go. So here's a question. What would you expect to see in a lacrimal gland biopsy in a patient with Sjogren's disease? And then the second part of the question, another question is there, but we'll do this one here. Okay, so each of them has a task word, right? And a topic word. And often there are limit words as well. So here we've got a task word. What would you expect to see in a lacrimal gland biopsy? So in other words, if we rephrase that, it's the histopathologic appearance of the lacrimal gland in Sjogren's disease. Now, if you start telling me the autoimmune changes seen in Sjogren's disease, the epidemiology of it, or its macroscopic appearance, you will get no marks.
And you'll waste time.
Yeah, so limit your answers to what's actually asked for, right? And also limit the questions that you are writing in your Cornell Notes left thing to small questions, because often the exam asks small and directed questions. Okay, let's have a look at this one. Outline, which means write dot points. The pathogenesis. So what's pathogenesis, Amanda? People often get confused between pathogenesis and etiology.
Yes, well, pathogenesis is a process, isn't it? It's a stepwise process of causation leading to the disease that we see.
That's right. It is a process. Pathogenesis is a process. They both begin with P, but often they begin in what call a landscape. So I often use the phrase LIPS to remind me about pathogenesis. So they occur in a landscape. So when writing about pathogenesis of Sjogren's, for example, I might write about patients who have, and I've actually forgotten, their HLA-B27 tendency towards Sjogren's disease. Environmental factors can trigger an autoimmune reaction. Okay, so that's the landscape. And then then there's the initiation, is I, LIPS. The initiation is T cells infiltrate the lacrimal gland and release cytokines, causing death of the epithelial cells, which are, and then P is progress, replaced by fibrosis. Okay, and then S is relating it to is symptoms, leading to dry eye. Okay, and that would be a good way to structure a pathogenesis LIPS landscape. So, you know, what's happening around the body to kind of cause it, the initiation in that organ, its progress, and then relating it to symptomology. Okay. Right, the clinical and pathologic features. So when people want clinical features, they want what you can see in the clinic, and that includes using the slit lamp and ophthalmoscope, okay? The pathological features overlap with that instruction, because when people talk about the pathological features, they also want the macroscopic pathological features. So if I was wanting the pathological features of retinopathy of prematurity, I might talk about the white reflex, for example, right, and not just what we can see down the microscope. All right, so that's the first step, is understanding the question. All right. So the questions, if I've rephrased them in my mind, was what is the histopathology of Sjogren's disease in the lacrimal gland, for example, or write bullet points on the pathogenesis, clinical and slit lamp, and histology of retinopathy of prematurity. So step one is rephrase it in your mind, understanding the task and the subject, not going off track, and then using a structure to explain pathogenesis. I use LIPS. All right, plan the structure of the answer before you write it, okay? Just write, and you can do it on the computer now, which is really great. Just write the topics, all right? Histopath Sjogren's, low power, high power, other points, right? Right, if you're doing the histopathology of Sjogren's. If you're doing RO retinopathy of prematurity, pathogenesis, you know, landscape, premature infant, initiation, high levels of oxygen, yeah, prevents correct angiogenesis. Progress, you know, new vessels, retina off, things like that. Okay. and then clinical and slit lamp and histology. So they're the kind of structures that I expect to be covered. And is this okay to write bullet points, Amanda? Do you like bullet points when you're marking?
Bullet points are good, particularly when the question says things like list, outline. Those are the cues to write short bullet points, because the examiner is looking for keywords and key phrases to tick off the marking rubric.
We find it very hard to find them in page-long paragraphs.
Running on sentences, just hard to read.
Hard to read. So good structure, short sentences or bullet points.
Like 1 point per bullet point, and then we can see if you've hit the point or not.
All right, so use plain language, keep your writing straight to the point, and use words from the question in your answer to signpost the answer for the marker. If they want the pathogenesis, clinical, and histology appearances, write headings, pathogenesis, clinical, and histology. This might seem pretty basic, but from the many, many scripts that I've written, there are people who still need this.
Yes. Headings are super good because it makes sure, because the marking rubric will also be under headings, make sure that you get the maximum marks per heading. If it's hidden in a narrative, you might miss out.
Yeah. And practice, all right? So remember, don't reread, just go to your notes and practice answering the questions as if they were clinical questions.
And you have to do typed, don't you? Typed answers.
Typed
so
answers.
You type it into your computer. Yeah.
Yeah. Okay. Right. But I don't understand what they're asking. So one of the hardest parts of doing the exam is actually to understand what they're asking. Okay. So in the chat, which I'm going to get Amanda to talk about, what would you to look at? What would you write about for macroscopic features of Fuchs endothelial dystrophy?
Macroscopic features. Well, that would be the appearances that I might see in the clinic using magnification.
Yeah.
That's those little beaten copper bumps. Yes.
Yep.
Yep.
Microscopic features would be from
under my microscope here. So I'd be looking at this little guttata.
Yeah. And natural history?
Natural history, and then I would talk about progression over time and risk factors.
So here's a great one. I hope we never write a question that asks for ocular manifestations of a disease. We're all trying to write more specific questions here. But if you get ocular manifestations, you can translate that into macroscopic and microscopic appearances and complications / natural history. Similarly, if you are talking about temporal arteritis and you want the ophthalmic features and pathogenesis, well, pathogenesis is easy because we've told you about writing lips now. But again, the ophthalmic features would be macroscopic, microscopic, and complications. Yeah.
Yes. So would that include what you might see down your ophthalmoscope when you're looking with your instruments, Diane?
It would, yes. So macroscopic, you know.
Yeah.
Yeah.
Okay.
Yeah. So in the eye as well as in the temporal arteritis.
Yeah. So it's people think it's just about the microscope. It's not. That's insufficient.
Yeah. It's you want to, when you're doing pathology, you definitely want to do your clinical pathology as well.
Yep.
Okay. What pathologic changes would you see following an ischemic event? Exactly what Amanda has said. You want to do clinical / macroscopic and then microscopic. What neoplastic conditions might, what's a neoplastic condition, Amanda?
Well, neoplasms are unregulated growth, usually clonal, but it can be benign or malignant.
Yeah.
Doesn't mean it's cancer.
Yeah.
So
often people think it's cancer. It's not cancer. We want the benign conditions as well. Would you include like things like hamartomas and chorostomas?
No, they're a different process altogether. So that's going back to, medical student, different types of pathological processes. Yeah.
Yeah. And then the final question, pathogenesis and pathology of retinopathy of prematurity. We've discussed this before. So pathogenesis, good, you know, landscape, incidence, progress, symptoms,
Lips.
pathology, lips.
Pathology, macro, micro.
Macro, micro.
Got it.
Yeah.
Yep.
Okay, and that's the end. Those are my top tips on how to prepare and pass the exam. And I suspect Amanda's top tips too, because we wrote the talk together.
Yes, because we want our protagonist, Trish, to pass her exams and be able to recall pertinent information whenever she needs it, not just in exams, but in real life, which is more important, really.
Okay, so
yes.
Then we've got 5 more minutes, and then I've got another session that I'm about to start on breast pathology. So if you're a registrar who's joining and unexpectedly has found some eye pathology people there, I'll be with you in 5 minutes.
Eye pathologists are excused from the breast pathology session.
Do you guys have any questions? Did we explain it clearly enough? What you have to do, you know what to do.
Or you can throw something into the chat. So
just email me, like, or Amanda. We're super keen to teach you and super responsive. Yeah.
Okay, good. Excellent.
Sorry, I just had one question actually.
Great.
Just with lips there for the eye.
Yeah.
Was it incidence or initiation or
initiation?
Both?
Initiation.
Okay. Sorry.
Open up the chat, and I've just written it out there in the chat.
Lovely. Thank you.
Yep, got it. Acronyms. It's good. Alrighty.
Okay.
So see you in a month.
See you in a month when we will do an in-depth dive into eye pathology, which you will have effectively learned by then.
And we're doing retrieval practice. We're not doing encoding. Retrieval practice. That's what we're doing. So it's got to be something in there to retrieve in the first place. Otherwise, you'll look like an idiot in front of your peers. There you go.
And on that note, all right, I'm going to stop recording now. And lovely to see you all.
Okay.